Our next speaker is the current Hospital Director of Urology Center of the Philippines and Chairman of the Department of Urology, East Avenue Medical Center. He is the current Secretary of the Philippine Board of Urology, Vice President of Philippine Alliance for Urolithiasis and Philippine Society of Uro-Oncologists. He was the past President of the Philippine Urological Association, past Council Member of the Urological Association of Asia, past Board of Governors of the Philippine College of Surgeons. Dr. Lantin earned his degree in medicine and master's in hospital administration at the University of Santo Tomas. He finished his residency training in urology at the East Avenue Medical Center. He went for further training in robotics at NARU's North American Robotic Urologic Symposium, master's course on robotic urologic oncology at Intuitive Surgical Lab, Sunnyvale, California, USA. He also had training on brachytherapy for prostate cancer at Chicago Prostate Cancer Center, USA, on green light laser for prostate in Bangkok, Thailand, and on quanta thulium laser for prostate at San Donato University Hospital, Milan, Italy. He also completed training on urolithiasis and endourology at First Affiliated Hospital, Guangzhou Medical Center University in China under the tutelage of Professor Guohua Zeng and fellowship in minimally access surgery at World Laparoscopy Hospital in New Delhi, India. Let us now welcome our next speaker, Dr. Pedro L. Lantin III.
Good day, everyone. First of all, I would like to congratulate the PUA Mindanao chapter and its members, headed by Dr. Rod Hipol, for organizing this annual event. I would also like to thank the organizing committee, headed by its course director, Dr. Nimrod Firasa, to talk about Urology Center of the Philippines, my recollection, my thoughts, 1995 up to 2021, 26 years of delivering world-class urologic care. Early 1995, an idea to establish an ESWL Center by then Pura President Benji Reyes was organized. We were in Las Vegas in our hotel room at the Circus near the American Urological Association Convention Hall when he invited me to join as one of the founding directors. I had some doubts about forming one because we were still residents at that time and might get the displeasure of a more senior urologist. After convincing me, we then invited other Pura members to join in, by the likes of Dr. Herman Sorongon, Dr. Noel Hipolito, Dr. Clayton Blas, and the likes. At that time, only PLI at St. Luke's Medical Center and Manila Doctors Hospital had an ESWL machine, but fortunately for us, Manila Doctor Hospital was about to fold up and eventually closed later that year. That started the ball rolling, as to speak. And recruitment of doctors, a combination of senior talented and well-known urologists in multi-institutional affiliations were underway. Dr. Ponce Bernardo from East Avenue, St. Luke's, Dr. Eduardo Gatchalian, PGH, Manila Doctors, Dr. Tony Anastasio, UE, St. Luke's Medical Center, Dr. Patron, National Kidney, JR and AFP, Dr. Mendoza, Cardinal Santos and East Avenue and NKTI, and Joey David from Veterans and St. Luke's, and Dr. Dan Mariano from JR. The fact I and Benji was on our senior year in training when the company was being formed and us being in the board of directors was kept a secret to prevent getting the ire of other urologists who were not members of the company. Many meetings soon followed, and in October 1995, the name Urology Center of the Philippines Incorporated came up. At the time, we just wanted to use UCPI as an acronym and make it as a low-profile company because we were hesitant to be criticized for using the name Urology Center by other senior urologists. And yet, the center only has an ESWL machine to boast of. On December 20, 1995, SEC registration was granted, and this cemented the company to the healthcare industry. On April 1996, the first venture of the company, the Stone Unit at Manila Doctors Hospital, was established, and Dr. Eduardo Gatchalian being the top honcho that took care of the everyday operations. Soon, the UCPI Stone Unit at Manila Doctors Hospital had shown an increase in census and revenues. This prompted the board in 1998 to venture into a freestanding ESWL clinic in Quezon City called the UCPI Ambulatory Care Center, headed by Dr. Tony Anastasio. By this time, we have established 2 ESWL centers strategically located, one in Manila and the other in Quezon City, which will actually serve almost all our members. We slowly expanded our services into a full-service hospital in Quezon City. And in 2006, we changed our name from UCPI Ambulatory Care Center to Urology Center of the Philippines in preparation to building a hospital. In 2011, November, the Urology Center of the Philippines Hospital was born and granted license to operate as a Level 1 specialty hospital by the Department of Health, making it the only private center or private specialty center in urology in the country. Our dream that UCPI to be internationally recognized was attained on September 2017 as UCPI was recognized by the International Alliance of Urolithiasis, headed by the most famous Professor Zeng from Guangzhou, China, as one of the training centers in endourology. Thanks a lot to Dr. Abet Aquino. And in 2018, the company acquired a 1,000 square meter lot just adjacent to the hospital and built a 3-story parking lot. This was in preparation for the future expansion of a 7-story UCPI hospital. And in March 2020, the coronavirus pandemic forced Metro Manila to lock down. This prompted UCPI for the first time since its opening to close its operations for 2 weeks to prepare for the unknown. I would like to present to you the present Board of Directors. The composition of the present Board of Directors includes mostly past presidents of the Philippine Urological Association, former chairman of the Philippine Board of Urology, and former and present heads of the recognized training institutions in urology. In short, there are the who's who in Philippine urology. I would like to present to you the mission of the hospital. It notes that we are an institution dedicated to provide affordable and high-quality urology care, advanced training, and relevant research in urology, thus contributing significant to improve healthcare in response to global challenges. The vision of the hospital is to be the best urology center in the Philippines and internationally recognized leader in urology. I would like to share to you, in my mind, the secret ingredient why UCPI is the #1 center in urology in the Philippines. Please take note of the following. Secret ingredient #1 is to make your institution the best in your specialty. Second, make it a Euro patient-friendly hospital. Third, prepare and learn the in and outs of the operation. Fourth, take good care of your finances. Fifth, take good care of your employees. And lastly, you have to pray and thank God Almighty. For secret ingredient #1, make your institution the best in your specialty. You have at least to do a benchmarking both locally and abroad to know what the others have in terms of protocols, prices, equipments, and the likes. Get the latest toys available in the urological field and make sure to have personnel available to teach, assist urologists that would use them. Recently, we have purchased an Artemis machine. It's an MRI fusion biopsy machine. We have the thulium laser for the prostate. We have the holmium laser for stones and the treatment of strictures. We have the brachytherapy for prostate cancer, low-dose radiation. We have the transurethral microwave therapy of benign prostate enlargement and prostatitis. We have the erectile dysfunction shockwave treatment therapy. We have 3 ESWL machines. We have recently acquired a urodynamic machine, and of course, we have an ultrasound machine dedicated for OR use. As much as possible, you have to have a complete array of urological equipments. We have a flexible ureteroscope with 2 rigid ureteroscopes on hand. We have a wide array of different sizes of nephroscopes for the standard, mini, and super mini PCNL. We have 2 C-arms available for OR for simultaneous PCNL cases. We have the latest ultrasonic and pneumatic lithotripter from Boston Scientific, Storz Calcuson, and 1 lithoclast. We have, of course, laser resectoscopes and a laparoscopic machine. The center also has an available ancillary units to support hospital operations. We have radiology, who boasts of 4 top-of-the-line world-class ultrasound machines. We have a CT scan dedicated for urological procedures, and of course, a new X-ray equipment. We also have a 4-bed hemodialysis unit. We have a complete laboratory facility used for most common urological problems. Of course, you should need a pharmacy, where the drugs will be available, that are used in daily urologic practice. Make your institution known by hosting workshops and conferences, both local and internationally. So as you can see, these are some of the international and local workshops. No? You could see famous doctors like Jen Strassweiler, Ali Gosen, no? Visiting the center. Okay. Secret ingredient number 2. Make your facility a Euro patient-friendly hospital. For urology-friendly hospital, you have to make sure that your doctors feel comfortable. You have to have a lounge for doctors where they could stay while waiting for their cases. Make sure that the urologist receives regularly monthly PhilHealth and professional fee reimbursements from the hospital. There should be an easy access of scheduling of patients and approvals of HMOs. And for new graduates and new practicing urologists, the center will facilitate their HMO accreditation. As a result of these Eurofriendly strategies, we have around 40 to 50 urologists now practicing monthly in the hospital. For patient-friendly hospital, for making this a patient-friendly hospital, make sure that the hospital premises are clean. You have to have safety protocols known to the patient. There should be an ease of admission and discharge. In fact, in our center, a patient after the procedures would be accompanied by a staff until he or she enters his vehicle. And recently, in addition to being the center, to this being a patient-friendly center, we have hired a dedicated staff that handles concerns and feedbacks from the patients. Secret ingredient number 3. You have to prepare and learn. Top people in the corporation should be qualified in their positions. Make sure that they have a master's degree on the field of interest. They should learn from people experts in their fields. You have to talk to people, no, and ask them their experiences in running a hospital. Should craft policies that is well structured, consistent, safe, and aligned with existing policies of the Department of Health, PhilHealth, Philippine College of Surgeons, and the Philippine Urological Association. I would like to share to you how we prepared for the COVID pandemic. No, we placed a remote treatment option for ESWL in which the doctor is outside the treatment area and is monitored by video and monitoring the procedure by video. We have a separate pathway for healthcare workers and patients. We have created protocols, no, for OR. As you can see, we usually change this every 2 weeks depending on the situation at hand. We also place a decontamination tent in the operating room, no, and for donning and doffing techniques are in place. Lastly, we have to learn from our past experiences. So we have, as far as I can remember, 2 sour investments. The first sour investment that I can remember was having a Eurovan. it was a good idea in which we could serve, no, provinces in Luzon without ESWL machines. No, but the problem is we have to treat cases as far as Bicol, and then the van would go as far as Ilocos. So it was not a good idea after all. The Eurovan was closed due to financial losses. And one thing learned here is do not invest in something in which you cannot directly help with. Second is the placement of an ESWL machine at Lucena, in which after a few months, it closed because of poor census. But then there's a quote, failure is not the opposite of success. It's part of success. Secret ingredient number 4, take good care of your finances. Many might not agree, but my advice is to expand within your means. Use money which you earned for the expansion. Don't take out loans from the bank, so there will be no pressure in making both ends meet. Second, check on the purchases of supplies and equipments. Get the best deals. Do bidding. Try not to overstock on supplies. Go to joint ventures and X deals with regards to your equipments. Hire employees that can do multitasking capabilities. From this, you can save, no, in hiring extra unnecessary employees. Treat company as if this was your own home to save on electricity and water. If you see, lights open without any people, I personally make rounds and close the light or the air conditioning if there's no people. So these little things, in the long run will save a lot, in the finances. And lastly, I would check on the cash flow every day before I leave the hospital, just to see how much money came in and how much money came out. What is fun is that I have no signing privileges in the corporation. But what I do is check every checks that is being disbursed, and every income that is seen by the hospital every day. That is before I leave the hospital. The formula used to make this corporation successful was to entice more urologists to practice at the center. So what we did was hold seminars, workshops, and advertise the center. If they see the capabilities of the center, they will bring in their patients. Our assumptions were right. Only one patient per urologist per month, that would bring patients here. For example, 50 urologists times one patient, there's 50 patients right away. So this formula helped us grow. Secret ingredient number 5, take good care of your employees. Remember, the greatest asset of the corporation is the human resource. Invest in your employees. Finance and support all learning activities for them to grow. Give them leeway to make decisions for them to build confidence on their own, and just guide them to the path of what is right. make sure that they get their salaries on time, for they need it. I remember when we were just starting and there was no money laying around, the top priority of the corporation was to make sure that the employees get their salary on time. I would like to share to you a quote from J.W. Marriott, an entrepreneur of the Marriott Hotels, and it states, "Take good care of your employees, and they take good care of your customers, and the customers will come back." I think this philosophy has been working for our company. Secret ingredient number 6. Don't forget to pray and thank God the Almighty. We have organized First Friday Masses. We have placed a 3 o'clock prayer habit, Angelus, and of course, we crafted a UCPI prayer early on 1997. By being close to God, everything will fall into places. Trust, honesty, and transparency between the board of directors, between the staff's members, will be easy to find. And lastly, for my take-home message, I would like to share to you Jack Ma's 10 rules. First, learn from the mistake of others. Focus on quality, not the size. Be the first. Prepare for the future. Respect your competitors. See challenges as opportunities. Believe that you can make it. Surround yourself with greatness. And the last 2 is live healthy and have fun. In that, I would like to close my lecture. And again, thank you so much for the organizing committee of the Philippine Urological Association Mindanao chapter for inviting me. Thank you so much.